All right. Well, why don't we get started? Welcome everyone to this live Q&A session on ADHD. We are glad that you could join us. And we're with MedPsych Associates. My name is Brian O'Malley, and Dr. Mohab Hanna is with us here as well, and he's going to be talking through a lot of your questions today. I'm as background on the MedPsych team, and I'm actually filling in today for Jonathan Byrne, who had an urgent issue come up, but I'll be the one asking the questions and checking your questions as they come in today. Just a quick background on MedPsych Associates for those of you that are not familiar. MedPsych provides psychiatry, therapy, ADHD and autism diagnostic testing, and executive function coaching. We have offices in Ramsey, Old Tappan, and Montclair, and provide in-person as well as virtual services to clients. And with that, I'd love to have Dr. Hanna introduce himself.
Well, thank you, Brian. So I am Mohab Hanna. I am a child psychiatrist, child and adolescent psychiatrist, if we want to be precise. I've been in practice since 2002. So I've had the opportunity to see probably several thousand patients at this point. I grew up in northern New Jersey, which is where I practice currently. And I was down in Baltimore, Maryland. I trained at Johns Hopkins and stayed in Maryland in practice till 2010, and I've been back up in New Jersey since then. I am married. I have 3 high school kids, and life is busy. So.
Very good. Well, just a few quick logistics for today. We received quite a few questions prior to this that we will intend on running through as many as we can. And then you're also able to add questions, ask questions through the course of this using the Q&A tab on Zoom. Those questions will be anonymous to the attendees. Only Dr. Hanna and I will see them. So feel free to ask whatever you like. We'll do our best to try to get through those as well today too. And also one note is that we will be recording this session and we will share that out to everyone who registered. So in case you need to leave a little bit early, you'll have that recording available. All right, so let's dive in. We do have some questions that can get us started. I think the first question, Dr. Hanna, is how does ADHD look like? What does ADHD look like at different ages?
Yeah, a very important question because ADHD doesn't always look the same. And one of the privileges I have is that I get to see kids grow up in front of me. I get to see young children and get to see those same kids grow up. And ADHD doesn't always look the same at different ages. And one of the interesting thing is, a lot of times, if let's say I'm seeing someone come in middle school, that will differ versus seeing somebody who comes in as a 30-year-old versus someone who comes in as a 6-year-old. The most common things we see when children are young, especially, I'm going to say young boys, and I don't know if someone has I think I saw a question that was going to be about the difference between boys and girls, but a lot of times we'll see kids who are being disruptive. The primary way that these kids will get attention is they're struggling behaviorally, both at home and at school. And a lot of times impulsivity will be the most prominent symptoms, and, or being fidgety and being hyper. And that's what gets everyone's attention. When kids are really struggling to control themselves, whether emotionally, verbally, physically, or decision-making. And so that becomes kind of a very common thing to see is the hyperactivity and impulsivity in kids who are younger. Now, having said that, not all kids who have ADHD at that age are going to be hyper and impulsive. And again, we're going to speak in generalities here since I don't know, the specific situations that typically ADHD girls that we see are not as hyper, not as impulsive, not as disruptive, which actually a lot of times means they get missed or people don't recognize it. But typically that's the predominant kids that we will see. It doesn't mean the inattention and the distractibility and lack of focus is not there. The interesting thing is so much of the difficulties we see with ADHD are centered around school and the academic environment. And so a lot of times that's where kids are starting to struggle. So as kids get older, as the work gets more demanding and the expectation gets higher for kids to manage schoolwork, then we start seeing kids start struggling with, as we enter the middle school, high school years, with a lot of academic struggles in terms of disorganization, missing assignments, handing in assignments late, procrastination, messiness, losing, misplacing things. Those symptoms become more prominent. And the reason a lot of times they might not be as obvious when kids are younger, one, the expectations are not necessarily there. And a lot of times, naturally, as parents, we micromanage our kids when they're younger. And so we will compensate for those things because as parents, we are heavily on top of those kids when they're younger. And a lot of times, schools also have very different expectations. The teachers are, don't have as high of an expectation in terms of kids being independent. And then what you'll find is that as kids get older and they enter college and even young adulthood, the work world, it really does become about the ability to perform in a college setting. This is where for those of you who are either in college or you're out of college, you recall, you don't get that many assignments in a semester. And sometimes, that's where one late assignment destroys your grade. You miss a couple of classes because you just forgot to go, and the consequences are pretty significant. Now, as for adults, I think a lot of times, which is really interesting, a lot of adults who struggle with this have a lot of anxiety. And so sometimes the presentation, and this, by the way, could be the case with a lot of kids too, as well, college kids, but where there's this chronic sense of just being overwhelmed and stressed out and not being able to either perform at work or even, honestly, even just doing tasks, daily tasks, keeping up with bills, keeping up with managing children or managing a household, where there's this chronic sense of being stressed and overwhelmed because lack attention to detail, being forgetful, missing appointments, forgetting to schedule appointments, forgetting things that are due at work, or taking a very long time to get tasks done at work and staying late. I've had plenty of patients tell me that one of their challenges is leaving their office. Or in this, if people are working from home, it's the same idea. Just feeling that things take them such a long time because they struggle with their focus and attention. And so the tasks are always taking a significantly longer time to get done, resulting in a lot of stress. And then where work then interferes with the ability to manage non-work life, family time, parenting, or other activities. So that's kind of just a general glimpse of it.
So you kind of alluded to this, but it was a specific question that came in about what differences do you see with ADHD with boys and girls? Is there anything you kind of highlighted? Is there anything else you want to thought about that?
Yeah, we can go back to that. So one of the reasons a lot of girls don't get picked up when they're younger is because typically they're not as disruptive. And a lot of it is, they're just as distracted. They struggle with the same types of things of being easily distracted, getting off task, being, internally, unfocused, where parents will say, boy, I got to repeat so many times to just get basic tasks done. And I've had this conversation, 20 times, to just get up and go to bed or go change and go brush your teeth, that repetitive kind of thing. But they're not disruptive. They're not getting attention in the academic setting. And a lot of times they might even be doing okay academically when they're younger, because the expectations are not as high as when they get older. Like I said, a lot of boys typically present with hyperactivity and impulsivity, but I'm always going to qualify things here because there's plenty of boys who are not hyper and impulsive who have ADHD. But I would say that's the main thing. And the other interesting thing that I also didn't mention is that sometimes those same boys, as they mature, their hyperactivity lessens, where a lot of times they're actually less fidgety and less hyper as they get older. And that's not their main concern at that point. They're not necessarily disruptive in that way. Now, they could still continue to be emotionally reactive, and get mad super quick and still struggle with managing their temper. But the actual hyperactivity and being fidgety and being physically impulsive that gets everyone's attention in the school setting gets better as kids get older.
There's another question that came in also I think you touched on really briefly before, but might be worth talking a little more. Someone was asking around, yeah, what is that interaction like with ADHD and anxiety,
Yeah.
especially in kids?
Yeah. Yeah. One of the, I'm biased obviously in what I'm going to say, but one of the benefits of when you're talking about ADHD is having a psychiatrist involved is because anxiety a lot of times looks like ADHD. And so the exact same symptoms that a child has of being fidgety, being sometimes even impulsive, disruptive in class, not listening, not paying attention, when kids are younger, it could be actually anxiety, not ADHD. And the last thing you'd want to do is to approach that child either behaviorally, or even if you're ever going to consider medicine, as if they had ADHD and it's really anxiety. So a lot of times it looks the same. But what you're going to find is with anxiety, it's not going to be there all the time. So what you're going to find is that a lot of kids are going to struggle in situations that are anxiety provoking. They're going to have a hard time listening. They're going to have a hard time paying attention. They could be potentially disruptive. They're going to shut down. They're not going to be cooperative. And they're going to come across a lot of times as being oppositional and defiant, right? Where they're going to disrespect the rules and they don't follow the rules. Anxious kids do that all the time. The difference is those same kids in other settings are actually doing okay behaviorally. And again, school is the predominant place where this anxiety tends to manifest itself, and where a lot of times a lot of kids get mislabeled and misdiagnosed as having ADHD when it's really anxiety. And if you try to do a medication for ADHD and the child is anxious, it can go very, very wrong. Now that's kind of one part of it. It's also not uncommon that a lot, and as I alluded to this earlier, that if you struggle academically or you are struggling even as a child with getting in trouble constantly at home with your parents, that within itself can lead to what we call secondary anxiety, where the child doesn't have, or the teenager doesn't have an anxiety disorder per se, but they get more and more stressed out and more overwhelmed. And there's this chronic sense of, I'm falling short, I'm not keeping up, I'm really struggling, academically. And there's this now foreboding anxiety about school. And then sometimes that anxiety will then generalize to other areas of life. And then the next step is a lot of times this anxiety then can lead to depression, where if a child is chronically anxious or a teenager, and again, if you're an adult, who's listening in, most of you probably are, that if you've ever been anxious, you know that if you're anxious all the time, first of all, it feels horrible and feels awful, and that frequently that will also lead to depression. So those are just some of the interactions that we see. So it can either be a primary anxiety issue that looks like ADHD, or the anxiety can be secondary. And by the way, this doesn't mean, if some of you are familiar with the term when we use comorbid, somebody can have anxiety and have ADHD. You can have both. So it's not that you can't have both. And a lot of times they'll feed off each other. The more anxious you are, the less you're going to be able to focus. You're going to be internally distracted. Think if you ever had a situation where you're worried about something, right? If you are stressed, or if you have some health scare or something going on, or your son or your daughter is struggling, you're going to be internally preoccupied. You're going to be thinking about that. You're going to be thinking about that while you're sitting at work, right? Kids are not any different, right? If they're upset about something and they're struggling socially and they got to have a lot of social anxiety, or they're struggling in whatever with their sport, or something's going wrong, they're going to have a hard time focusing and paying attention. So that means anxiety itself causes those core symptoms. You're not going to be as on top of things. You're going to be careless. You're going to not, not be attentive to detail, and so on.
So a question came in a minute or two ago, and it kind of ties to what you were talking about before about how ADHD manifests over age ranges. So I'll ask it now. Is it too late to be diagnosed in your later years, 50s, 60s, if you suspect you have ADHD? I was diagnosed as hyperactive as a child, but never medicated. Based on what has been discussed or what I read, I think I have ADHD.
The answer is no, it's never too late. But the first question I would, when I think about, because I actually have seen patients who come in their, in their 50s, and the question is, what are you going to do with the diagnosis? Let's say you do have ADHD, is it interfering with your function? Because I think that's what's important, is just because somebody has ADHD, it doesn't mean you're necessarily going to do anything about it if it's mild, right? And if it's not actually interfering with your function and your ability to carry on your primary responsibilities in life of whatever those might be, whether that's vocationally or family or taking care of a family member or whatever it is. So it's not too late. And if those struggles, if you're someone who runs late all the time and you're not on top of things, and it's problematic and it's affecting, again, your ability to function, it's something that is definitely worth considering. What I find that a lot of times with adults, it's the anxiety. It's the chronic stress of really struggling with managing life is what drives most people to say, I need to do something about this. This is exhausting mentally, right? And a lot of times people will tell me that I have all this clutter in my head and my brain is just bouncing off the walls. I sit down to try to do a task, and next thing you know, I'm getting up to do something else. Everything's taking me a long time. Life is just hard. And it's always been like this. And I'm hitting a wall. I'm like, I can't do this anymore. And so the interfering with function is also because of the stress and the anxiety as a consequence. So it's never too late. But I will say this, though, because I run into this frequently. My threshold for wanting to treat for someone's older is higher because of the medical consequences. So the nature of the medications that are prescribed for treating ADHD, whether the stimulants, which a lot of people, I don't know if people are familiar with that term, those are like what everyone's heard of, like the Ritalin, the Adderall, the Focalin, the Dexedrine, that whole world can actually increase your blood pressure and your heart rate. And so as a result of that, as we get older, we're going to be more prone to those negative side effects. So a lot of times what we actually do with many adults in our practice is we will ask for a cardiac clearance before we even do medication. So if we feel like, wow, the benefit of the medicine outweighs the risk for sure, and the risk of me not doing something is, the person's really struggling and it's worth doing a trial, a lot of times we will ask actually a cardiologist to clear for us to make sure the EKG is normal, to make sure family history, there's no family history of any arrhythmias, any sudden death, anything unusual cardiac wise, that the person does not have high blood pressure. So we as a rule kind of will do cardiac clearance. So as you get older, again, the consequences get bigger in terms of medically. And so that makes us weigh benefit versus risk. So the answer is no, it's not too late. There's nothing wrong with beginning treatment at 50 or 60, as long as there's a clear indication that the benefit of the medicine outweighs its risk, and that the risk of not treating and not doing something about it is not a big deal. Having said that, one of the other things you can do is, let's say you do have ADHD and you're like, I don't think this is kind of bad enough for me to go on medication. Well, it doesn't mean you can't do something about it non-pharmacologic, because a lot of people just assume that the only thing is I need to pop a pill and that's it. I think therapy could actually be helpful / coaching, because we know that the habits that we do every single day are of tremendous value for us. So if you're someone who's disorganized, having someone come alongside you as a coach and actually help you to come up with some strategies to be organized will be extremely helpful. If you're someone who's easily distracted, beginning to identify, hey, when does this happen? What distracts me? What's the context? What tasks am I doing? And again, having a coach or a therapist come alongside you to problem solve and come up with a game plan to address whether it's procrastination, time management, planning, all those things can also be helpful. and not uncommon, to be honest, that a lot of times I will recommend that first, actually, before I will want to do a medication for someone. I like us to always use the most conservative approaches first and to try to address things from either behavioral or therapeutic perspective. If you're someone who's anxious as a result of your ADHD, there's value to learning strategies and ways to cope, right? Learning how to manage your anxiety. What are the different ways that you can manage your anxiety? Hey, what is your sleep pattern like? What time do you go to sleep? What time do you get up? Are you exercising at all? Right? Are you incorporating exercise? Do you incorporate breaks into your work? And then not to get on my soapbox about technology, are you trying to do work all the time while your phone is there right next to you? Probably not a good idea for any of us, but especially if you are prone to that, right? Technology is not helpful at all. And so again, we're talking about some very basic things, and sometimes implementing those can be extremely helpful before you even get to the medication conversation.
So this question has come up a couple times from people now, and you kind of alluded to it in the prior one, so I'll ask it now. What are can you describe stimulants versus non-stimulant
Sure.
ADHD medications, and what are the pros and cons considerations?
Got it. Yes, that's a common conversation I have in my office. So you know, we use these categories of stimulants versus non-stimulants. So kind of going back, so stimulants are by the reason they're called stimulants is because they actually cause wakefulness. That's the reason why they're called stimulants. So caffeine is a stimulant, right? It causes wakefulness. It's not a sedating medicine, but that the term has stuck. So a lot of times when we talk about stimulants, we're talking about mixed amphetamine salts, which is better known as Adderall, methylphenidate, which is the whole Ritalin family, dexmethylphenidate, which is the Focalin family, and then dextroamphetamine, which is the dextridine family. The stimulant medications have been around since the 50s. So they started being used in the 1950s, and most of the studies started around that time. The sheer body of research is gargantuan. It is, when I tell people that the stimulants for ADHD have been studied in thousands and thousands of people all over the world, more than almost any other actually class of medications, people are kind of shocked. They think somehow this is a new thing, but no, there's a tremendous amount of data. But as a result of the tremendous amount of data, we know the good, the bad, and the ugly. What we do know is they work really, really well. They're actually some of the most effective medications for treating anything, but we also know that they have a lot of downsides. And I'm going to go back to this. The non-stimulants are newer. For a while, the non-stimulants, which are also not controlled substances, and when I say controlled substances, I'm talking about there's something called a Schedule II. The DEA, the Drug Enforcement Agency, and the FDA, they designate certain medications as controlled, right? So like things like OxyContin and Percocet are controlled substances, right? Things like Xanax and Ativan and Valium and that whole entire world are controlled substances. The stimulants are controlled substances. Practically speaking means I can't write refills on them. And historically, prior to us being prescribed electronically, you couldn't call them into a pharmacy. You had to do an actual paper prescription. Thankfully, we're in 2024 and I'm allowed to do electronic prescriptions. Although I have to do a two-factor verification on it and have to have all sorts of security clearance to do that. But that's more of a practical issue. The non-stimulants, the original non-stimulants were the old tricyclic antidepressants in the 1970s. If you guys have heard of anafranil and imipramine, they're drugs that we don't use as often, but they were the original, not Adderall, not Ritalin, not Dexedrine-based medications that were used to treat ADHD. The non-stimulants right now, the most commonly used are atomoxetine, better known as Strattera, which has been out since 2002, and then older drugs called guanfacine and clonidine, and then there's a new one called Qelbree. Those are really the four main non-stimulants. A lot of times people ask about Wellbutrin, which is an antidepressant that has been studied, but I think if you have legitimate ADHD, not great. Its efficacy in terms of how well it works. Now, here's some big differences. The stimulant medications work as if you're taking a Tylenol. If I have a headache and I take a Tylenol, it's going to take about half hour to 45 minutes to kick in, and it's going to work for a very specific period of time. The stimulants are just like that. They work for a very finite period of time. So if you take a stimulant like an Adderall or Ritalin at 9 a.m., It's going to kick in probably by 9:30, maybe 9:45, and it's going to last, if it's a short acting, 4 to 6 hours. If it's a long acting, 10 to 12 hours, and then it's gone. In other words, it's not there when it's out of your system from an efficacy perspective, effectiveness, and when you first wake up, it's not there. The stimulants can actually be taken as needed. So that means, and this is more common with my adult and college student patients, where say, I really struggle in my lecture hall, and I really struggle. I go to a big state university, and there's 200 kids in the class, and I really struggle and have a long day and have 3 classes. I'm going to take it just on those days. I'm able to do my work fine on other days, but I'm going to take it. So they take it 2-3 times a week. That's just one example. Adults, same thing. Boy, I got some tough work days, and it's on those tough work days what I really, really struggle, and I will take it that. Most younger kids, we don't do that. And that's kind of a common conversation I have with a lot of parents about kids. We tend to do it 7 days a week. The non-stimulus needs to be taken every day. They are a build-up kind of medication. Now, the interesting thing about this is that the stimulants work really well for hyperactivity, impulsivity, focus, attention, and working memory. They work for everything for the period they're in your system. The non-stimulants, atomoxetine, which has been out since 2002, right? So we have about 21 years of data of using it, is a good option for kids who are maybe not as hyper, not as impulsive, or more inattentive and distracted. Doesn't mean it can't help at all. It's just not as good. I always give the analogy, because I'm a baseball geek. The Strattera hits you doubles, the stimulants hit you home runs. Of course, what that means is the home run hitter, sorry, I apologize for those of you who are not baseball fans like I am, but the home run hitters strike out a lot. They mess up, so they have side effects. Hitters who are contact hitters, who are double hitters, don't strike out as much, so they have less risk in some ways. But each medication has its own risk profile. Strattera needs to be taken every day, and it needs to kind of build up over time. Guanfacine and clonidine are old medications that came on the market for blood pressure, and they can make you tired and sleepy. So we use them a lot for younger kids for hyperactivity and impulsivity because they work really well. The biggest issue with them is they can make you sleepy and tired, and they can lower your blood pressure. So we have to make sure kids are well hydrated. And one of the interesting things about them that we see with kids is that when you do a guanfacine and a clonidine, they can make you much more emotional, much more sensitive if you're overtired as a child. So on a regular basis, I have to pull back sometimes on the doses of medications, because some kids, they go on these medications, become really irritable, more emotional, more sensitive. One of the things that I kind of preach over and over and over again with these medications, if someone's on an ADHD medication and they go on a medicine and they notice a change in their mood, or they start getting more anxious, and you see any change at all in how they're doing emotionally, assume it's the medicine. You got to think that it's potential side effects. The other big thing is that the ADHD medications, the stimulants, lower your appetite. So one of the challenges we have with kids is I got to monitor their growth, because it decreases your appetite and you're less hungry during the day. You might not grow as well. So we got to monitor height and weight on them. And so that's one of the challenges with the stimulants. The other thing to be aware of is if your child or you are not eating during the day, you're going to be much more vulnerable to the negative side effects of the medications. Feeling flat on the medicine, feeling jittery, feeling even heart racing, feeling emotionally sensitive, like crying, feeling edgy, feeling like I don't want to talk to anybody. I don't like how I feel. Food makes a huge difference. People always ask me about the food, and my big thing with food is if you're on medications, you got to be very protein focused when you take these medications, so you don't get spikes in your blood sugar level. Because if you have carbs in the morning with the medicine, it's going to go up and go down. And if you have the medicine in your system, you're not going to like how you feel. Many of the negative side effects that we run into with medications in general are because of not eating enough. And that is a constant battle that I have of tweaking, dosing, long acting versus short acting. With the Strattera, it can lower your appetite, just not to the same degree. It can also make you tired. I still have to monitor blood pressure and pulse. The interesting thing about Strattera, if you've ever been on Strattera, if you've ever seen the package insert, it has a warning about increased suicidal thoughts. So what that means is this medicine can negatively impact your mood. So whoever's prescribing, if you're on this medicine, they need to monitor your mood very closely, especially when you start the medicine and when you go up, because in some kids, I have seen it cause depression and cause suicidal thoughts.
So one question came in as you were speaking. Can you take stimulant and non-stimulant at the same time?
Good question. I have done that before, numerous times with my patients, but here's the scenario. And it can go either way. Let's say I put somebody on Strattera and I reach a dose that I don't want to go above because of side effects, but it's a partial benefit. In other words, it's working, but it's just not cutting it. It's like such a partial benefit. Sometimes what we will do is we will add a short, like a small dose of a stimulant and do that. But here's the challenge. It can increase your blood pressure and pulse. So I don't like the idea of doing this. I prefer one medicine. My inclination is to be as conservative as possible, use the least amount of medicine possible. I don't do this often in terms of combining a Strattera with a stimulant. However, we're more likely to combine a stimulant like an Adderall, Ritalin, Focalin with guanfacine and clonidine. And the reason is that's kind of a different combination because the guanfacine and the clonidine counteract the negative side effects of the stimulants. So one of the big side effects of the stimulants is they cause wakefulness and insomnia, so it's hard to fall asleep. Sometimes in some kids who have a hard time settling down at night, I will prescribe a low dose of a clonidine or a guanfacine to address the ADHD symptoms at night, to help settle down at night, and to help regulate sleep. I also do have some kids where it's kind of the same thing, where the medicine's working partially, and then I will add a stimulant or vice versa. I always get an electrocardiogram. So even if it's a child, if you're combining two medications that are affecting heart rate and blood pressure, I always do cardiac monitoring. It's one of those things where you always want to be extremely, extremely cautious. These medications are very effective for what they do, but they really do have some serious side effects and they require regular monitoring. A lot of times people underappreciate the level of monitoring they require, whether it's checking blood pressure or heart rate that we do regularly, or height and weight, or sometimes getting electrocardiograms. It is that big of a deal. We have picked up cardiac arrhythmias on our patients actually doing this. So, sometimes if there's a family history of any cardiac arrhythmia or AFib or anything, a lot of times we'll do the electrocardiogram before we do the medication. And then sometimes I will see high performance athletes, kids who are really performing at a very, very high level, whether it's Division I athletes that I've seen or kids who are, doing pretty intense sports. We will get an electrocardiogram before we do medications in that context as well.
This question came in a few minutes ago. How much of ADHD is about motivation / volition versus actually attention? And how can one motivate an ADHD teen who doesn't seem to respond to long-term motivators like doing well in school, getting into college?
Yeah. That's a really good question. Motivation, it's interesting. When I think of motivation, I think of mood. In other words, my desire to do whatever task it is, whether it's the desire to go out with a friend, desire to initiate, sitting down, getting my homework done, or my desire to, put in the hours for sports. And so mood is the lens through which we do life. And it is not uncommon, and I want to differentiate the word motivation from what I'm about to say. Task initiation is hard for kids with ADHD. And especially task initiation on tasks that require sustained mental effort. And so the way to kind of think about this is my child has a global lack of motivation for anything, right? Are they just a kid who doesn't want to do anything, right? Who's not interested in having fun, is not interested in doing any activities at all? Or are there specific tasks where they come across as being not motivated? Most likely, when parents are asking me this question, it's schoolwork, right? And the two are tied in together, but it's really task initiation. It's the ability to stop what I'm doing, right? A preferred activity where my brain doesn't have to work that hard to focus and attend, to transition, to begin to sit and have to do a task that requires sustained mental effort. When I was talking about secondary anxiety frequently, one of the reasons we see a lot of kids avoid, right, and come across as not having motivation and being lazy, right? A lot of ADHD kids get accused of being lazy, is this process of stopping what I'm doing, sitting down, getting started on a task that sometimes is frankly boring and not interesting, or hard in some ways. Is that it's the dread, it's that sense of dread. So one of the things I try to figure out with my patients is it that you're anxious to get started? Because again, anxiety, this could all be anxiety. So sometimes lack of motivation is actually anxiety of feeling paralyzed, feeling overwhelmed by the task. I just don't know where to start. I'm totally overwhelmed by this. I have a paper that's due, hanging over my head. I don't even know where to get started. So it's not that I lack the motivation. I'm just overwhelmed. But motivation and our desire to do things is obviously essential for getting any task done. I tell kids all the time, I can give you all the medicine in the world, but I can't make you sit and do your homework if you don't want to. In other words, if you also show up to class and you have no interest in focusing, it doesn't matter what medicine I give you. If you're walking into class and you're going to choose to walk into class and to not focus, I can't help you with that, right? I can't give you a pill that's going to make you do the paper or study if you're not interested. However, it is important for us to be a little bit more thoughtful and figure out the why underneath the what, right? We know anxiety gets in the way of doing tasks that require sustained mental effort. We know that frequently depression or feeling hopeless or feeling demoralized gets in the way. One of the things we see frequently with a lot of people is demoralization. So kids start struggling academically, their grades start dropping, they start getting anxious, and then they give up. And so then all of a sudden you will see a kid not want to do work anymore because they've just given up. What's the point, right? Why bother, right? And so it's not a true chemical clinical depression, but it's what we call demoralization, kind of just a feeling defeated. What's the point? Why bother? And then that's kind of the lack of motivation part that comes in. In terms of the long-term motivators, you're going to find that from a maturity perspective, a lot of adolescents, especially ADHD kids, long-term motivation does not work. It is very hard for a 14, 15-year-old when they're sitting there on a random Tuesday night and they have to study for their history, for their US history exam, to think about applying to college 2 years later and how studying for this test, whether they get a B or a C, is going to actually make a difference in their life. Very hard, right? And there's a maturity that comes with that. As adults and parents, we see big picture. We know everything matters in some ways, that all this stuff matters, but it's very hard for them because you have to remember that ADHD kids are 3 to 4 years behind sometimes with emotional maturity. Their brain development, their frontal lobes develop later. So the ability to connect my action to the consequence is impaired. They don't see it. They don't see that when they didn't put any effort and they didn't do well, that next time they're faced with the same consequence, that they're going to retain what that felt like and what that was like, and then be able to implement that. That's a maturity issue. And one of the biggest frustrations for a lot of parents are going, they're 16 years old. I don't understand why I have to remind them to go take a shower and brush their teeth and remember to take their, whatever for sports, and how could a 16-year-old keep forgetting their lunchbox at school or their whatever, right? Or their binder right? Well, because they're 16 in terms of who they are as a person, but sometimes their frontal lobe might be about a 12, 13-year-old level. And so you get this huge disconnect in terms of ability to recognize consequences. So you always want to have kind of a task reward consequence that's more very, very short term. I think kids respond much better to that in terms of the shorter term reward. And by the way, when I say reward, I never mean buying stuff for kids and giving them like extras. I'm talking about the things they already have that they're just dependent on achieving, doing certain things. I know this is going to sound like kind of stupid, but they shouldn't be watching a basketball game if they haven't done their homework, right? That's the kind of thing, we're talking about.
Question on symptoms that's come in. How common is it for a child to keep their symptoms under control at school, but then explode at home? And another question that came in was around what are social symptoms of ADHD kids?
Yeah. So a couple thoughts on this. The exploding at home, I kind of when I hear exploding at home, I actually I have a specific type of kid in my head. They're usually an anxious kid. And they're usually sometimes anxious ADHD kids hold it together in school, right? They just hold it in, right? And especially if they're not prone to hyperactivity and impulsivity, they're hard to notice. And by the way, if your kid is smart, like if they're of above average IQ, they're going to compensate. They're going to do okay, right? Their grades are not going to really stand out or become an issue till maybe late middle school, early high school. So they don't get noticed, but then they come home and they just let loose because anxiety leads to irritability, and anxious kids are very irritable. Think about if you're anxious and stressed, you're much more short with your spouse, you're short with your kids, you're more likely to get mad. True for all of us, whether we have ADHD or not. Well, if you have ADHD, you're emotionally impulsive, you're emotionally reactive. And so you kind of have, if someone's under stress, so if your child is stressed at school, doesn't even necessarily mean they have an anxiety disorder, but if somehow school is really, really stressful for whatever reason, whether for academic reasons or social or whatever it might be, or it's just not a good fit for them, and then they come home, they're going to explode. So that's actually not that uncommon. I have tons and tons and tons of parents who will tell me that no complaints from school, but at home their children are not manageable behaviorally. And a lot of times it's just stress and anxiety is the reason, and then the child's impulsive. So that's fairly common. And in terms of, Brian, what was the question about social?
What are social symptoms of ADHD kids?
Yeah, a lot of social skills are learned, and they're learned by observation. And what you're going to find is the reason a lot of kids struggle socially is because they're not in tune. They're spacing out, they're distracted. That's one thing. In other words, their availability to actually be in tune and read social cues of what's happening is not there. But then you're also going to get they're impulsive. And so if children are disruptive in class, they're going to struggle socially because sometimes they will overreact to kids. Unfortunately, I've had many kids who will hit other children in school because someone said something they didn't like. So then it has social implications in terms of other kids going, whoa, okay, don't like that, right? And then sometimes other kids will pick up if the child's disruptive in class. So then they will struggle socially in terms of, again, the impulsivity. They're very touchy, right? As kids get older, a lot of times on the social, you will see the impulsivity play out in decision making. The things kids will say, sometimes they'll get in trouble. This is why social media is such a disaster for a lot of kids who are impulsive, because it's by its nature, it encourages impulsivity to just click on things and so then kids can be where they'll make a comment or they'll say something or they'll post something or they'll get into click on that pornographic website or gambling, or they will bet on the baseball game and the football game, or sometimes buy things impulsively, right? So we'll see, and then there's negative consequences on that. But to just kind of summarize, ADHD kids can struggle socially because of lack of awareness, right? They're not aware sometimes of their own physical space. They don't read nonverbal cues at times, right? They kind of miss them. They miss that someone is not listening to them or they're not listening a lot of times to the conversation, so they tune out. One of the questions I ask teenagers sometimes, do your friends ever say, dude, we just talked about this. We just literally just said this, where you're asking questions and the kids are missing it. They're like, where have you been? And a lot of kids, they laugh and go, oh, yeah, that happens all the time. My friends say that to me all the time, because they just tune out, they space out. Or they'll tell me they'll meet somebody and they'll say their name and they realize they weren't listening. That will be the adult, right? Like you're in a meeting and you meet someone, or you're at a party or something, someone introduces themselves and you realize you were so focused on something else. You have no idea their name, even though they just told you 30 seconds ago. So those are just an example of how it comes out socially.
We had a couple questions come in here live, and it's kind of similar to some other ones that came in too. Have a 13-year-old child, has a hard time starting homework with me. And as a parent, wanting to help him be independent, how do I give him this independent, but at the same time make sure that he can kind of manage his responsibilities the right way. And then also asked related to the Google Chromebook for the 13-year-old and the kind of managing the distractions and the addiction to the screen, but it being a key tool for doing the work.
Yeah. That's a dangerous one, the second one, because that's something I have a strong opinion on, and you could probably guess what it is about. That's a huge distraction. But in terms of the 13-year-old, let me say this in terms of independent. So in a perfect world, your 13-year-old would be independent. But thinking back to what I said about maturity and brain development, if the 13-year-old has ADHD, and I'm be totally honest with you, they need to be micromanaged. If someone has real ADHD, that it's not just a screen addiction, that it's not just the phone, if it's the real thing, you're going to find that a lot of kids are just not mature. Now, when I say micromanagement is they need what I call scaffolding. They need the parents' help to create some sort of structure. And something like a structure, when I say that, is, hey, when you come home, okay, you can take a break, but let's go through all your classes. Let's take out a piece of paper, write out what each thing that needs to be done. Okay, you're going to have dinner at a certain time. Hey, once you work on this for 20 minutes and take a break, once you work on this, after the break, right? In other words, you have to create a structure. This is why a lot of times we do actually the executive function coaching stuff, because what you find is they need much more structure than you realize, and they need much more support than you realize. So again, in an ideal world, the 13-year-old with 7th, 8th grade, right, would be independent. But I just think a lot of boys especially are not there, including some who don't have ADHD, right? And so, I understand the reasoning we want our kids to be independent, but I think a lot of ADHD kids are not there. They don't have the skill set. They don't have the maturity from a frontal lobe development to be able to organize themselves and do that. They need to be taught. They need to be taught the skill set to learn how to do that, how to organize, how do I manage my time? One of the challenges for a lot of kids is lack of time awareness. They don't realize how much time is elapsing. They lose track of time so easily because they don't have that internal clock in terms of knowing, oh, that was like 15, 20 minutes. Sometimes it's like, they think it's 15, 20 minutes and it was an hour and a half, right? So they do need much, much more structure and scaffolding than typical. So I get you want independence, but at that age, that's really tough.
You referred to executive function coaching a couple of times. It might be helpful to just spend a minute just to describe what takes place with those. We see a lot of high school, middle school, high school kids, college students. Maybe just describe it a little.
Yeah. When I ask college students what's their biggest struggle on college campus when they first go off to college, right? First semester, they come home, or sometimes if I'm doing an appointment around Thanksgiving, they're like, oh, I can't manage my time management. I can't figure it out. Now, that's also the case for middle school and high school kids. So a lot of when we talk about executive functions, this is what we're talking about. We're talking about, some of it is task initiation, planning, organization, time management, right? And sometimes we talk about executive function in terms of even like ability to control self, but in terms of self-control. But what executive function coaching does is it's the think of what a coach does for an athlete, right? They come alongside you and they come up with a plan. And they basically look at all those things, all your struggles, and they come up with solutions. It's a solution-focused game plan, right? As if you're a coach from the outside, problem solving, what's working, what's not working. Hey, you know what? I think, for those of you who are golfers, right? Your shoulder's opening up too much, or, if you're a tennis player or whatever it is, or your baseball swing, right? Actually, I don't think this is working. Let's problem solve this. What did you try? What didn't work? What worked? And then a lot of times try to provide accountability. in terms of keeping kids accountable, especially some of the older kids. Sometimes for some of those kids, at least the way we do it, there's a little bit of helping kids to study, learning how to study a little bit. But that's kind of the general idea. It's problem solving, coming up with a plan to address those symptoms kind of from a habit perspective on the behaviors and the skills.
This one question came in, might be relevant for some that are listening. What's the best place to start if I have concerns about my kid having ADHD?
Yeah. If you're suspecting that, couple thoughts. One is I would want to know what the school sees, right? I would want to know, hey, talk to the school, try to understand what it is they're seeing. Do they have any concerns? Right? Because if are you having those concerns because they are struggling in school, but to get a little bit more of a thorough conversation on the school end, in terms of to get a sense of how problematic is this, right? Do they have those concerns? You know, if your son or your daughter is involved in any kind of other activities, does anyone else see this, you know, this issue? So usually school is always my first one. Is like, talk to school. That's the first thing. Depending on the age, sometimes we actually say, hey, you might want to test your kid's hearing. I know it sounds obvious, but if kids are young and we have concerns about them not listening, we just want to make sure, you know, that we're not missing something obvious like their hearing. Or if they're sitting in class, do they need glasses? Again, I'm stating like the obvious here. You just want to make sure you don't miss the obvious things, you know, of what it is that's going on. Next steps would be, you know, beyond that, a lot of times people will usually talk to their pediatrician first. Or depending, you know, so much of this depends on the extent of your concern, right? Is this interfering with their function enough that you really should go get a formal evaluation from someone like a child psychiatrist to really assess? One of the other things to think about is I always want to make sure we're not missing learning issues, right? I did not bring that up, but it's very common for a lot of kids with ADHD to have learning disabilities, and to struggle with dyslexia or dyscalculia, which is like math or writing, right? They have a hard time with writing. And just, again, talking to the school, what are they seeing? What is the school seeing in terms of learning and aptitude? Those kinds of things. So school is really usually the first steps to talk to school.
This question came in, where to start to improve one situation when recently diagnosed as an adult, when acquired anxiety is already high? Is it advisable to take a break from work, go on sick leave?
Right. Yeah, it'd be very hard to address that part because a lot of that depends on how anxious, but addressing the anxiety for sure, right? If you're really struggling with that much anxiety, that's got to be addressed at a minimum therapeutically with a therapist, right? Well, we know therapy can be very helpful in terms of cognitive therapy, to help that. The other issue is, of course, is if you're so much of your anxiety is because of the ADHD, then definitely you're somebody who needs to evaluate your options in terms of treating the ADHD. Again, hard for me to answer about taking a leave from work without knowing the specific situation. And so I'm going to punt on answering that one. So
There was one follow-up question from what we were talking about earlier around non-stimulants. Are there negative side effects to non-stimulant ADHD meds? Like,
yeah, there are. Yeah. So yes, in terms of just to kind of go over again, Strattera and guanfacine and clonidine all can make you tired. Strattera can lower your appetite. It can cause appetite suppression. Guanfacine and clonidine actually cause weight gain. So they can, you know, people gain weight on them. Guanfacine and clonidine lower blood pressure. Strattera increases heart rate and blood pressure. All of them can make someone more emotional, more sensitive, more irritable, more edgy. One of the things that I actually did not mention, people ask me a lot of times, why would you use a non-stimulant versus a stimulant? It's a really good question. Besides the profile of the ADHD, if someone has really bad anxiety, so if someone's anxiety is what I'm going to call like a primary anxiety disorder, because the stimulants, the Adderalls and the Ritalins of the world can make anxiety worse, they can exacerbate anxiety. our preference is to go the non-stimulant route. Because if you're anxious and you go on an Adderall and a Ritalin, it can make you very anxious. It can make you more obsessive. It can make you feel more panicky. It can make you more nervous. Sometimes kids will become more socially anxious. They overthink things. It makes you ruminate more. And so as a result of that, if someone has what I'm going to call moderate to severe anxiety, I will a lot of times start with a non-stimulant because the risks of the stimulant. The other thing I'd not mentioned, just also regarding side effects and the difference of the stimulant and non-stimulant. If you either have yourself a history of tics, like motor tics or vocal tics, or your son or your daughter has any kind of like abnormal involuntary movements, like shoulder shrugs, neck stretches, any kind of twitching or vocal like Tourette's, grunting, sniffing, snorting, throat clearing, any squealing, the stimulants can make that worse. So it's not uncommon where we will discover someone has an underlying tic disorder by going on a Ritalin and Adderall, and it makes things really bad, right? So it can make them worse. The non-stimulants, the Strattera, should not, it's neutral. Guanfacine and clonidine actually help to treat it. The other thing is if your son or daughter has obsessive compulsive disorder, any obsessive compulsive tendencies, the stimulants can make them worse. They can make someone more compulsive in what they do and worse than OCD.
Very good. Well, we're about at time, and so I think I'll wrap the questions right now. I will remind attendees we will share the recording of this with you, and you'll be able to see it. It'll be on our YouTube channel, it'll also be on our website. Also, I'd mention we have done some other websites in the past that are on the YouTube channel and our website around ADHD and executive function. So if you want, and Carol Eng, who
Right,
is
I think there's a webinar, right? There's a
our
webinar.
executive function coach, if you're interested in that, you can check that out. But we're really thankful that you could join today. Thank you for all your questions. We got through a good number of them, but
Yes, we apologize that we could not get through all the questions that we got, but maybe we'll have to do this again.
Yes,
So
yeah, exactly. Thank you all for joining, and everyone have a great day. Thank you.
thank you.